Hello, my name is Robin. I am your MP for the day, and I am working for Regis College. Can you tell me your name and date of birth?
Evan DeSola, 52085.
Okay, well, good. Today we're going to be completing a cardiovascular, peripheral vascular, respiratory, and abdominal assessment where I'll be looking, listening, and feeling for normal functions. Do you consent to having this video done of this exam for Regis College?
Yes.
Okay, good, thank you. All right, so I am providing privacy and washing my hands, and we can get started now. So, good that you're laying back already in the position that I need you in. I am going to ask if I may expose your abdomen, please.
Yes.
Okay, let's step this way. Okay. All right, so right now I'm just inspecting the abdomen. I am turning the camera a little bit. I'm inspecting for symmetry, looking at the contour, looking for any lesions, striae, any rashes, just looking at the movements of the abdomen, and everything looks pretty good. Now I'm going to take a listen in all four quadrants. Okay, and I'm starting with the, first quadrant here. We'll move down. Okay. Okay. I'm going to start here at the aorta. Listen to that. Now I'm going to the iliac. Now the renal. And the femoral arteries. Just listening for any bruits. Okay. All right. Now I'm going to go here on the right and listen for the liver. Okay. Now I'm going to go over here and listen for the spleen. Okay. Good. Now I'm just going to percuss each quadrant of your abdomen just to note like the tympani and the sounds in each section, okay? Okay, now on your right side, I'm going to percuss over the coastal margin of the liver. Okay, and just estimating the liver span and percussing the borders. Okay. Okay, now I am going to percuss at the anterior axillary line right here. You can lift your arm up just a little bit. Put it down. Okay. Okay. Now I'm just going to assess the size of the aorta. Okay. Now I'll just do a light palpation of each quadrant of your abdomen, and I'm just noting for any tenderness, any guarding, or anything. Okay. And I'll move around again in the same movement, and I'm just going to move a little bit deeper, okay? Okay. And this is deep palpation. Okay, now I'm going to go on the right hand and palpate for the liver. Okay, and now I'm just going to assess the kidneys. Left and on the right. Just assessing for any tenderness and masses. Any pain?
No.
No. Okay, so now I'll identify the location of the McBurney's point. So I'm going to locate the right iliac area and the umbilicus, and then I'll meet right between the line, and that is where McBurney's point is. Do you feel any pain with that?
No.
Okay. Now I will palpate for the Robson's sign, and that's where I'll just apply pressure on your left side of your quadrant, and you, when I lift up, you tell me if there's any pain on the right side, okay?
Yeah.
Okay. Did you feel any pain?
No.
No. Okay, good. All right. So that suggests not positive. Good. Now I am going to assess for the psoas sign, and that is where I'm going to place my hand on your right knee. Put your legs up for me.
Up.
Down. Sorry. All right. And I want you to lift your thigh against the resistance of my hand. Do you feel any pain with that?
No.
Okay. No pain in the abdomen?
No.
Okay. Now I'll assess for a positive arbitrator sign. So now I'm just going to flex your right thigh at your hip and bend your knee. And then I'm just going to rotate internally. Do you feel any pain with that?
No.
Okay, good. No pain in the abdomen, no pain at the hips?
No.
Okay. Now I'll assess for a positive Murphy's sign. So I am just going to palpate the liver's edge here. All right, I'm going to ask you to take a deep breath. Okay. Do you feel any pain with that?
No.
Exhale? No? Okay, good. All right, now can you just sit upright for me? Okay. Coming around. I'm just going to inspect the chest here. Just note for how you're breathing. Look at the skin. Make sure everything's okay. Any pain there?
No.
Okay. Now, if you can just breathe in and out, I will assess your accessory muscle, looking for retractions, looking at the shape of your chest, looking at the side area, making sure there's no deformities, and just assessing the contour. Okay. Now I'm just going to palpate the chest wall. You let me know if you feel is any pain.
No.
Okay. Okay. Now I want you to say 99 every time I move my hand.
99. 99. 99. 99.
Okay. All right. Now I'm just going to check for expansion. If you can just take a deep breath in. Out. Okay. In. Out. Okay. And out one more time. Okay. Now I'm just going to percuss the chest, noting for any abnormalities. Then I'm going to go in a right to left pattern, okay? Okay. Okay. Now I'm just going to take a listen in your lungs, just listening for the pitch and the duration of inspiratory and expiratory sounds, listening for any adventitious sounds, okay? Breathe in, out. Okay. Okay. Now can you turn your back towards the camera, please, for me? It doesn't matter if you stand. Okay. I'm going to raise your shirt up, and I'm just going to assess for tenderness in the CVA region, okay?
Yeah.
So I'm just going to do a little bit of light tapping. You tell me if you feel any pain.
No.
Okay. 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 Now you can, I am just going to assess just for voice transmission sounds. So whenever I move the stethoscope, you say E and then ah, okay? E.
E.
Mm-hmm.
Ah.
Mm-hmm.
E. Ah. E. Ah.
Okay. Now I'm going to assess for bronchophony, and I am going to move the stethoscope the same as I did before, and you just say Scooby-Doo with each movement, okay?
Scooby-Doo. 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 Scooby-Doo.
Okay, so now I'm going to assess for a more exaggerated form of bronchophony, and that is where I'm going to have you say, it's going to be whisper pictillary. I want you to whisper 99 every time I move the stethoscope.
99. 99. 99. 99. 99.
Okay, You can have a seat for me. Okay. Now I'm just going to move on to the cardiac portion of it. So I'm just going to look at your neck, and I'm just going to assess for any JBD, any carotid pulsations. Now I'm going to listen for any bruise in the carotid region. Okay. Now I'm going to palpate here at the maximal pulse of input. Okay. Okay, good. Now I'm just going to take a listen, put both the diaphragm and the bell over the aortic space, the pulmonic, the Erb's point, the tricuspid, and then the mitral valve, which is at the fifth left intercostal space. And I'm just noting for pitch, any murmurs, everything sounds good. Okay. Now we will do, if you could, let me just flex your arm here. Sorry. And I'm just inspecting. Okay. All right. You could take a deep breath for me here. Okay. All right. That was just assessing for mitral stenosis. Now I'm going to assess for aortic regurgitation. Now I'm just going to put the bell of the stethoscope, the diaphragm of the stethoscope over the carotid pulses. Okay. Okay. If I could just have you lean a little bit forward for me. And if I can just have you breathe out and then hold. Okay. Okay, good. Now I'm just going to palpate your radial and brachial pulse. If I can have you flex your elbow at 90 degrees. I'm going to assess for epitrochlear node, lymph nodes. Same on this side. Okay, flex your arm 90 degrees. Okay. Now, if you could place your arm up and out. And I'm just assessing under the armpit, down the axillary line. Okay. And I'll come on this side and do the same. Okay. Now, if you can hold your hands for me, I'm just going to assess for any inguinal lymph node. Okay. Okay. Now I'm going to assess the lower extremities. Okay. Just looking for size, symmetry, edema, color, and pigmentation. Everything looks good. Do you mind if I remove your socks?
No.
Okay, so I'm going to assess for the femoral groin. Okay, the popliteal, which is behind the knee. Okay, the dorsalis pedis, which is at the top of the foot. Okay, and the tibial posterior. Okay. Okay, now I'm just assessing for peripheral edema in both your legs. Okay, assessing for temperature. Everything seems good. Okay, now I'm going to ask if you can hold your hands out for me and then squeeze tight a few times. Now squeeze tight one last time, and then I will compress your radial and your ulna. And then I'll let go just to assess how the blood returns. And I'll do the same on this side. Okay, good. All right, so this concludes my exam at this time. I'm going to step away for a second, assess the findings, and I'll come back to discuss with you. Is everything okay?
Yes.
All right, thank you very much.
Thank you.